Australia with single-payer health care for all. Today, ACT UP is marching for all those who cannot. What you see before you is 50 black body bags, symbolizing the annual death rate of 18,000 people per year due to the lack of health insurance. ACT UP has been advocating for HIV and AIDS patients for several years, and now they're taking a step towards a solution by standing with single-payer national health insurance. I'm here with Sean Berry, and he's one of the demonstrators here at the ACT UP March. What are your feelings about the march today?
Well, I think it's a powerful demonstration that universal health care isn't just an issue for people with HIV, but an issue for millions of Americans. About 250,000 people living with HIV who need treatment in the United States can't access it. The public health care system is broken. Private insurers won't enroll people with a pre-existing condition like HIV. So it's an enormous issue for people with HIV, but much broader for the United States.
Are you a member of ACT UP?
Well, I'm actually a Director of Prevention Policy for the Community HIV/AIDS Mobilization Project, CHAMP, and a supporter of ACT UP New York.
What's CHAMP exactly?
We're a national HIV prevention advocacy organization, and we actually view quality health care as essential in HIV prevention, because if someone has access to health care, it's less likely they're going to have to engage in survival sex, for example. They'll have low viral loads, so it's less likely they'll transmit the virus onto someone else. And it's a human necessity, therefore it's a human right.
Do you have anything else to say?
The ACT UP New York played a powerful role in bringing the cost of AIDS drugs down in the United States and expanding access around the world, and I'm excited that they're going to bring that same energy to supporting single-payer healthcare in the United States.
Can you explain what single-payer healthcare is for the audience?
Well, it's a guarantee that there would be a standard of health care for all Americans, regardless of whether or not they could afford to buy into private insurance. So one model could be expanding and improving the current Medicaid and Medicare systems.
So how did you feel about the demonstration that took place today?
I think it's really important. It's an important demonstration, a totally important issue. The idea that our health care is attached to the companies that we work for, that's not what the demonstration was about, but that's my personal opinion. It doesn't make sense for the way that we live today. People like myself who are independent, we work at various companies, we do various things, we're artists, whatever, and that we depend on a company for our health care, and most of us don't have it.
How do you feel about single-payer health care for all?
Count me in on that plan. That sounds like what we need, because what we have isn't working. It isn't working. It was working for a few people, but not for everyone. And we need something that's going to help everyone equally.
How do you feel about the 50 body bags that are pictured right there?
It's disgusting. It's disgusting. It's just so dramatic, you know. It represents people's lives, people's experiences. So I think it's potent, powerful.
What each of these body bags is symbolizing is 50 people per day that are dying of the fact that they have no health insurance. I know it's 18,000 per year, but think about 50 people per day. 50 of your relatives, 50 of your friends, 50 people that you see every day on a daily basis. And this is pretty much what it is. The lack of health care, this is what it does.
What do we do? Fight back. People with AIDS are under attack. What do we do?
ACT UP, fight back.
When people with AIDS are under attack, what do we do?
ACT UP.